terrible diseases, the lung cancer, but not everything is a disaster. There's a very nice woman who had part of her lung removed about 20 years ago and was having recurrent problems without a good explanation. Well, Dr. Sitar was curious. We did all of our studies, and we thought it was going to be important to take a look down her windpipe, and what we found was at some point in the past, probably years ago, she inhaled one of the little silver foil-backed packets that covers the pill, you know, when you pop the pill out. Somehow that made it into her windpipe.
Of course.
Exactly.
Yeah.
But somehow that made it into her windpipe and caused a really profound irritation. We took that out. She's doing remarkably well now. So that's, you know, one of those good success stories that you don't hear of very much.
Strange but true.
Strange but true, and it's the kind of thing that could have gone on for years and years and years if Dr. Sitar wouldn't have said, this is not making sense, we need to look more at this. So it's a perfect example of why a place like a lung center makes an awful lot of sense for folks. People who've got problems that are just not going to go away unless somebody really grabs onto them and works those problems out.
Right, right. You mentioned the working with sleep apnea and whatnot. Berger does have a sleep center. How do you work with them in tandem?
Actually, I'm the medical director of sleep lab as well. I run that sleep lab, and we are doing a fair number of sleep studies over there to diagnose obstructive sleep apnea syndrome, which is again very common. You know, it affects at least 4% of adult population, and you know, children as well. So we diagnose them and we treat them with whatever treatment is necessary. Either it is CPAP, which is continuous positive airway pressure. If they need surgery, we will send them for surgery to treat their sleep apnea and potentially prevent the problems that can happen down the road, including strokes and heart attacks and things like that.
We hear a lot about diabetes as a problem in society now. How does that affect, or where does that fit in at the lung center?
Diabetes in general, you know, it's part of the syndrome of, you know, obesity, and then with that comes hypertension, diabetes, and then they have problems with, you know, sleep apnea, and then heart disease and strokes in general. So diabetes is basically a little bit everywhere. And it does make, you know, their treatment a little more difficult. They're more prone to have recurrent infections, especially pneumonias and things like that. Yeah,
and just more things to work with and look for in a patient. Dr. Kishka, how do we get to see you? If I'm having trouble breathing, do I just come to the office, make a phone call, or do I need to be referred by my primary care physician?
You can make a phone call and come in. Your family doctor can make a phone call. We're very available. And one of the most important things about the lung center is the ability for a patient to kind of take control of their own care and say, I want to be seen. I think I need to be seen. Very often that discussion happens with the family doctor. And the family doctor is key in making sure the care stays coordinated. The family doctor is key for us to have communication with after somebody does get to the lung center. But getting there, very simple. They can call, their family doctor can call, family members can call, and we work very quickly to get people in and get them looked at in a timely fashion so that we can start getting some answers. Very often, there's lots of testing that needs to be done and coordinated. So a big part of the lung center's job is coordinating those things and having those communications.
That's good. That's good. So my primary care physician will say, hey, John, we need to send you here to the lung care center at Berger Health Center, and just to find out what in the world is going on, right? Yeah.
What's going on? What are the best treatments? Are we doing everything we can do? Sometimes there's too much treatment. Sometimes the best thing that we can do is simplify things. Maybe take people off of some of their medicines. If they're on 2 or 3 medicines, reduce that down to 1. Or change the way those medicines are given to the patient. And that manipulation is just as important as adding new things.
And it's very important working with other physicians for those medications, because I see, and I have to believe that there's over-medication sometimes, and sometimes the left hand doesn't know what the right hand doctor is up to, and things do get, what do I want to say? They get complicated when the medications aren't
Well, I think
correct.
that's exactly it. And like we mentioned, most of these patients have many things going on. You brought up diabetes. There's heart disease. So you have the cardiology doctors, the diabetes doctors. It's hard for us all to know what everybody's thinking as we're thinking it. So the lung center really views a big part of its job as keeping that care coordinated and making sure everybody knows what everybody else knows.
Right, that's good. What about environmental concerns in our community that would lead towards a problem with the lungs? Do we have that here in Pickaway County?
It's everywhere, with industrialization, people may have more exposure to the industrial dust and whatnot. So it's very important to wear the proper, protective things that they have been advised to wear at their workplace to prevent chronic bronchitis and those kind of things down the road. Mm-hmm. We used to have problems with asbestos in the past, but now it's not as big a problem. But proper protection equipment is very important for patients to wear at the workplace if they're working with chemicals and things like that.
Yep. Southeastern quarter of the state has been known for their coal mining. Now we hear about, or we have in the past heard about black lung disease and whatnot. Do you still see that, or have those people passed away? I'm afraid.
We still see sometimes, but Pickaway County does not have as big a population of black lungs as you might see in West Virginia and things like that.
Yeah, but that is still always a concern.
Right, yeah.
All right, asthma. We hear more and more about problems with asthma, and especially with younger children. What are you seeing at the lung center?
Asthma is common, and with more indoor, pollution. It used to be more outdoor pollution that used to cause lung problems. Now we are seeing more indoor pollution in the form of, having pets inside and the carpeting, which traps the house dust mite. So that's becoming more and more common, and we see a fair number of those patients. And we do their pulmonary function test to see if they have asthma, and if they have asthma, we put them on proper treatment and educate them about control of indoor pollution, which is becoming more prevalent these days.
Yeah.
And get them to, if they need allergists to have allergy shots, we get them to allergists. If they have concomitant reflux, which is very common with asthma patients, we treat the reflux, and that way we give them good quality of life if we can.
Mm-hmm. You were talking about dust and dust mites, but everything that's manufactured sort of off, I forget what the term is, but it leaks out the gases and whatnot out of the fabrics and
right.
carpeting and everything, and that is as big a problem as just your ordinary
right.
dust, correct?
You're absolutely right. You're absolutely right.
So are you making recommendations to families to, hey, remove those curtains and put up some?
I try to do that. I know
shutters?
people don't take these things very easily, but I try to tell them that probably the best thing to have at least in the sleeping area in the bedrooms is not to have a carpet, probably a hard floor or wood floor or linoleum, things like that, so that there's not all the house dust mite that's trapped in the carpets and then causing the problems. And sometimes removal of those things, lead to remarkable improvement in symptoms. Mm-hmm. So, but it's not very easy thing to convince people that, that you need to get your pets out of the bedroom and you need to get your carpet out of the bedroom, things like that. So.
That's right. That's getting a little personal with people,
yeah.
isn't it?
Yeah.
So what are you seeing most often here at Berger Health Center, the lung care center, as far as a lung disease?